Okay. So today we are going to see a case study video. So what is case study video? So this type of case is a new case which I am seeing right now in my clinical practice. So what is the name of the case? Periventricular leukoariosis. So this name itself is a different name. Periventricular. This means it will be affecting the ventricle area. Okay. So how many ventricles are there? 4 ventricles are there. Okay. So this type of periventricular disease, it will be causing for the most type of old age people and associated with diabetes. Here I have listed certain causes. So this type of cause, it is completely coming for my personal home case. Okay. Cause, age. My patient age is 80 years female. Okay. Now she is being identified with diabetes for past 20 years and she is taking and she is under the medications. Okay. And she is also having the chronic small vessel ischemia, which we recently found out in the CT scan of the brain. So these are the causes. So first of all, while the patient is coming to me for the physiotherapy management, so I listed out certain causes and listed out certain physical findings. Physical findings associated with the clinical findings also. So what are the clinical symptoms which I saw when the patient was interacting with me? Gait disturbance. What is the gait disturbance? While the female, 80 years female, we all know 80 years female will be having the gait problem. What gait problem? Normally all the old age people will be walking very slow, stoop. So these types of things which we have seen. Now she is also having the urinary incontinence. The incontinence to control the urinary bladder. Why? It is also because of the old age. The muscles will be going for the weakness, so it will be going for the urinary incontinence. And this is the proper findings, that is the cognitive decline. These two will be going for the normal for each and every old age patient. But cognitive decline, what is cognitive decline? Like memory, okay, the doing of the certain motor skills. Motor skills will be divided into two, that is fine motor and the gross motor. Fine motor will be going for the handling the pencil for writing, pen for writing, putting the buttonings. Okay, so these will be going for the fine motor. Gross motor things. What is gross motor things? Handling big things. What are the big things? Like taking a vessel from one place to another, carrying a bottle of water and keeping the bottle of water from down to the upflow. So these types of things could be going for gross motor skills. So for this, so I evaluated all these things and I went for the treatment. So at present, I am treating this patient for past 6 months of time. Okay. So what is the stage which I was starting my treatment and what is the current stage? At stage which I was started my treatment, she was very much in gait and urinary incontinence problem. Now these two has been reduced. So I introduced the pelvic bridging exercises, pelvic floor muscle strengthening exercises. For gait patterns, I followed the mirror therapy. What is mirror therapy? Keeping a long mirror from here till down. I made the patient to walk from there till the mirror by watching the mirror. So based on the brain's activity, if a person is following the mirror training, the brain's activity will work how we are walking and it will rectify the problem. So this training was followed for 6 months of duration. Now it has improved, a very good thing. Even for urinary incontinence, pelvic floor exercises, it is a good thing. Cognitive decline. So here I used very much a new technique, but this type of technique has been followed for each and every field. Playing with the cards. Card playing is normal in the summer time. Now we are in summer time, it's normal. But I introduced this card for the 80-year-old patient to follow the cognitive improvement. How to improve the cognitive improvement? 4 types of card are there: heart-in and diamond and other 2 flowers. I'll be asking the question, pick up the heart-in 10, and she will be picking up the heart-in 10 and she will show it. First stage, before 6 months, she was very much disturbed in taking up the cards. But at present, she is very much useful to taking the cards in a frequent of seconds. So this type of periventricular leukoariosis will be managed by the physiotherapy management along with the certain medications. We need to visit the neuro doctor, neurosurgeon for the improvement. And this type of cases, we need to make the proper assure that these type of patient will not be going for the strokes. If they are entering into the stroke, dementia will be coming, okay, and other certain things, movement imbalance, complete movement loss, bedridden. So these types of cases will be happening. So we need to cut short all these things with the proper medication patterns. Thank you.